Good afternoon, everyone. If you're dialing in right now, we'll be starting just in a few moments for the COVID-19 check-in that will be starting in just another minute or two. I'm going to wait till everybody loads in. All right, good afternoon, everyone. My name is Jason, and I work for WASAC, and I want to welcome you to the COVID-19 check-in webinar today. Before we get started, I wanted to go over a few housekeeping items. Most of you should be familiar with this by now, but if you would like to raise your hand and ask a question, you can click the raise hand icon in the webinar. There's also a chat box or a question box. Everyone is automatically muted, so if you want to ask a question, you raise your hand, we'll unmute you. If you're joining us by phone, you'll have to press *9 on your phone. That way we can know to unmute you there as well. As mentioned, there is a chat box. If you want to ask any questions to the panelists, you can put that in there, or we encourage you to use the question and answer box. On screen, you should see a presentation slide announcing the COVID-19. So if you don't see that or you're having any issues with audio, please use the chat box and let us know. Otherwise, I'm going to go ahead and pass it off to Jamie Bodden.
Thanks, Jason. Appreciate you setting this up. And welcome everyone for this week's check-in call. Like in past weeks, we are doing some live polling again during the call. So get out your cell phones and we'll let you guys get everything set up. Again, if you want to join via your cell phone, text Washington ST 983 to 22333. Or if you're on your computer, you can join by going to pollev.com/WashingtonST983. So thanks for joining the live polling. Appreciate that. Like Jason said, this webinar is being recorded. We're able to post those to the WASAC website a couple of days, and do take advantage of the chat box that we have during the webinar as well. We check that regularly during the webinar. So today we're going to have a guest speaker, which will take up about 30 minutes of our time, and it'll involve a Q&A. So again, please utilize that chat box if you have a question for our speaker. We'll do a brief situational update, things that are happening at the federal level as well as the state level, and then a time for us to share anything that's happening locally as well. And then again, we'll have an ability to do some discussion on some emerging issues. So again, one more time to join the poll site. If you're on your phone, text Washington ST 983 to 22333. So Washington ST 983 to the number 22333. Or if you go to pollev.com/Washington ST 983, you'll be able to join the poll as well. So to just get everybody started and make sure that everybody can join the call, where are you calling from? Please let us know the state, the county, the city. Looks like somebody's at their house in a beautiful house. The island, Orcas Island, Wahkiakum, Walla Walla, Mount Vernon. Great, thanks for sharing that. We'll give you a few more minutes to enter. So it looks like we have folks again from all over our state. We have people in Yakima and Pasco, Island County, Ellensburg, Kitsap, the islands, a house. That's great. You're doing your work at home and social distancing. Largents, I wasn't invited to the party. I'm a little hurt, Commissioner Largent, but I'll forgive you this time. Great. Wonderful. Looks like our
we have a question from Jonna Exner.
Okay. Jonna, go ahead. You might need to put yourself on off mute if you're on the phone. I believe that's
Can you hear me? I apologize. I hit the wrong button.
Nope, you're coming in loud and clear.
Sorry, I hit the wrong button. I have no questions at this point.
Okay, great. Well, now you have practice for when you do have a question and how to unmute yourself. All right.
Yes.
Wonderful. Great to see everybody participating in the poll. Looks like it's working. So wonderful. So right now I'd love to introduce our guest speaker, Lisa Brown, who is our Commerce Director for the state of Washington. Lisa was really great in accepting our invitation to come to speak to you all about a number of the things that the Commerce Department is doing in its response to COVID-19, as well as being willing to take questions from you all. So Eric, I'll turn it over to you to add any additional thoughts before we let Director Brown have the floor.
Great, thank you. This is Eric Johnson with the Association of Counties. Thanks for all of our members that are joining. And thank you, Director Brown, for joining us. One of the things that our members asked last week on this call was really how do we be thinking about not just our response, but our recovery, particularly as it relates to the economic viability of our counties and our communities. And I know that Department of Commerce has that in mind as well. And so really want to thank you for being here and for sharing with commissioners, council members, some staff members from throughout the state on what they should be aware of as we partner on this, not responding, but thinking about recovery as well. So thank you very much. And I'll turn it back over to Director Brown.
Well, thank you. First of all, just a mic check here. Can you hear me? Is that good?
Yes,
Yeah.
you sound
Yeah, we
great.
hear you good.
All right, thank you. And thank you for doing this by audio and not video today, because I've been on too many of these video chats and it's Friday and I'm happy not to do it that way. I'm doing this from my home in Spokane, and my husband's home office downstairs, and I'm upstairs closest to the coffee pot. First of all, thank you for inviting me, and thanks to everyone who's on the call, because I know your time is really precious. You're working hard on behalf of your communities, your counties, and the Department of Commerce wants to continue to engage with you as a partner. Many of you probably know my local government assistant director, Mark Barkley. Commerce has a short name, but a larger portfolio of things that we work on, with our local government and infrastructure work being a major part of our work. We also have housing and community services, state's energy office, and economic development work as well. So in the midst of this public health crisis, we're engaged with just about every part of the emergency response, except for the very health-focused piece of it. But I think we all know that our goal in terms of the restrictions of economic activity and the very unprecedented measures that have been taken to reduce the spread of this novel virus is aimed towards, when we hit the spike of the infection, which is now estimated to be around the middle of April, possibly as early as April 11th or after that, that our healthcare system has the capacity statewide to handle that surge and therefore not experience the types of healthcare system overload that have been experienced in other places. The good news is that we seem to be on track there. And so that is the good news. The bad news is, as everybody knows, this is the aftershocks of this in terms of our economy, our businesses, family incomes, farms, communities, it's just a dramatic and unprecedented effect, record unemployment claims, et cetera. So our goal is to get to that place where we are on the downside of the infection, the virus spread, and be working with our public health professionals in every county to reintroduce social and especially productive economic activity, possibly many times in new ways and in safe ways. But I know that you're all also focused on getting past emergency response in your counties and moving on to economic recovery. A few of the things that we are doing at Commerce, because we do have housing, we worked early on to get contracts out there to every county in the state for the alternate response, or you might call them isolation and quarantine beds. The latest from that work group is that there is appropriate work underway in almost every county, and that if we are able to get past the surge in the healthcare system, it's this isolation, quarantine, alternative care facilities that will also continue to be significant, because there are people who need perhaps not to be in a hospital bed, but they also may not be able to isolate or quarantine at home. So that work is underway, and we should have a good sense by Monday if we're on track with our projections to be able to handle that across the state. We also, of course, work with the Emergency Management Division and the work, a lot of work streams that are going on at Camp Murray to respond to this utilizing the emergency management framework. So at Commerce, as we turn more to the economic recovery side of the equation, we see our work in a couple of different buckets. One bucket is economic analysis by region and by sector. So that's everything from agriculture and food supply chains to energy and tech and retail, outdoor recreation, tourism, et cetera. So that economic analysis by region and sector is underway. It's going to look pretty grim for a while, but we hope to utilize that information to help guide us in recovery policies that we would implement either at the state level or work to influence at the federal level. Another part of this is working with my fellow state agencies, the Employment Security Department, Department of Labor and Industry, Department of Ag, et cetera, to help coordinate the information that we have and to get it out to people in as clear and coordinated a fashion as possible. The best website is still coronavirus.wa.gov. That portal is being updated every day. It's got everything from the latest statistics and health information to specific information for families, educators, businesses, workers, et cetera. We're working right now to try to understand and integrate information from the latest federal stimulus package, the CARES Act, to provide that information on this portal, as well as to coordinate between the state assistance programs and the federal assistance programs. The legislature also included, before they left in the supplemental budget, a $200 million emergency response package. Pieces of that have already gone out from OFM, with the top priority being the public health system. But there are some pieces dedicated to economic recovery. The legislature passed a fund that you may be familiar with. It's previously known as the Strategic Reserve Fund, that the governor could use outside of the legislative session in partnership with our economic development entities across the state, the ADOs, to do job retention or recruitment. We'll be announcing early next week a program, again, in partnership with those county ADOs, for small grants to very small businesses. The fund is about $5 million, so it won't go far enough, but hopefully it will go to every county, however, and the smallest businesses in every county can apply for it, 10 employees and under. And we're looking at it as a partial bridge for some of these businesses that might not be able to take advantage of Small Business Administration loans, the new Paycheck Protection Program, and some of the other things that are coming down at the federal level. And then as we move beyond the peak of the infection of the virus, past the surge, our goal is really to have a economic recovery conversation that engages our local government partners, as well as our business associations, our labor associations, our tribes, philanthropy. We know that there are different segments of our society and communities that want to be engaged in this conversation. And we will want to have regular conversations with you about that piece as we go forward. I'm hopeful that in one of the next stimulus programs, we will be able to help influence a major infrastructure investment. It's something that I'm sure everybody on this call knows is long overdue anyway. And so part of our goal is to be prepared for when those types of federal policies occur, and to be able to efficiently tap into them on behalf of our communities across the state. I think I will stop there because I'm happy to take some of your questions. I'm not going to be able to stay for the whole meeting, but I have some more time. And so why don't I take some questions, if that makes sense, to our moderators.
Yes, thank you. And thank you so much for that summary. I think that's really helpful. Just a reminder for folks that if you do have a question, to type it into the chat box and we'll make sure we add it to the queue. And if you're on the phone, make sure you raise your hand, and then Jason will make sure that we get you added to the queue as well. So while we're waiting for questions to come in, I would love to hear if you know, Director Brown, there's been, as WASAC, part of our staff work on policy issues. And so with session ending, and we ended on such a great high note in terms of the budget. And we know that going into COVID response, that is drastically looking different. And in fact, today the governor vetoed a lot of budget items. Do you have any idea of how that might look going into session next year, if there's any talk about kind of recovery packages or looking at tax structures or anything like that going into next year that you're hearing or think might be on the horizon?
Well, clearly we're still early enough into this that we don't have any definitive estimates, but I heard a credible economic analysis that predicted a $4 billion drop in state resources going in terms of the state revenue. And so I think that's probably part of what you're seeing here is reductions in the budget, vetoes of prior spending priorities based on being able to, we have a rainy day fund, but in order to even create a bigger cushion for the kind of spending that will need to happen during a recovery period and in preparation for a significant downturn in state revenue.
Great. One question that's come in relates to the housing grant that came in and the $30 million funding that was available. So incredibly valuable, and we're seeing a lot of that getting put into work right now in our local communities as a lot of efforts are ramping up around that. But we also have heard from a lot of our local partners that that funding is not going to be adequate kind of in that long term. Do you know if there will be an opportunity to get more funding towards those sheltering, isolation facilities, things that that housing grant was intended for?
Yes, I mean, our initial estimate of what was needed in this regard, I think our conservative low estimate was $80 million. So the 30 million that we were able to start with was essentially 10 from that emergency response and 20 that Commerce essentially pulled forward even before the budget was signed. So two pieces of this. One is that I'm sure everyone is connecting to their own county emergency operations activities, but there are things that can be charged, if you will, or requested as resources through that emergency management system, FEMA, et cetera. So that's one piece and one thing I would encourage everyone to take advantage of to the extent that they can. Secondly, we know that it's not just a facility, and some counties have been very creative about creating those facilities, whether it's a county fairgrounds or hotel or whatever. It's also staffing them. And so I'm on daily calls. I think the governor hired Admiral Bono to come in as the director of the health system during this emergency, and conversations are going on, and there's a great deal of awareness that staffing and funding for that staffing is a key part. So just to say that the problem is known, and it was never expected that this would be enough money to handle that piece of it. And hopefully those resources can be identified, if not on a county by county basis, at least on a regional basis, so that we're not experiencing a severe mismatch between what's needed and what's provided.
Great, thank you. And we have a follow-up, I think, kind of comment to that, in that one of the challenges that's been faced in the past with Commerce grants are the administrative burden. And I think that's true with pretty much every grant that we receive from the federal and state. And that's been a lot of concern. Is there a plan to help kind of mitigate that administrative requirement or burden, just knowing, kind of given the situation where it's kind of an all hands on deck situation, and that time that is able to be dedicated for that administrative kind of component is pretty few and far between?
So not knowing exactly what is meant by administrative burden, I'm guessing that it's the reporting requirements in particular. Commerce and other state agencies do have some flexibility under emergency rules to lift certain aspects of our reporting requirements. For these particular housing grants, I believe they're probably as flexible as any grant contract we've ever put out, with ideally a lot of flexibility. We also know that there are probably additional flexibility coming with some of the federal funds we're going to receive, such as community development block grant funds that we traditionally pass on to smaller rural counties. So we are trying to be strategic about understanding what that flexibility looks like and helping to alert our local government partners as to some of the options that they might have with these new funding streams that they wouldn't have had in the past.
Great, thank you. We have one more question in the chat box, and then I saw that Commissioner Hughes raised his hand too. So one question coming in is, do you know if any of Commerce's funding in the supplemental budget was vetoed today by the governor?
Actually, I'm a little bit late in the loop on that one, so I don't know for sure. I knew of some ideas that were floated earlier, but I actually don't know what occurred in the end. So I'll look forward, so to speak, to finding out what happened there, just like the rest of us on the call.
Yeah, I think we're all a little anxious about that. Thank you. And then Councilmember Hughes, if you can unmute yourself on the phone, go ahead and ask your question.
Yes, Director Brown, thank you very much for all the work. You've been quite inspirational and supportive, especially for us smaller rural counties. I'm getting hit from every angle on what we can do to assist low-income families to help pay their mortgages. The amazing money that we've already issued $120,000 out to our family resource centers of money to keep the rental stuff, and we're booking hotel rooms, et cetera, with the very generous money that came out of that granting cycle, but we don't seem to have a plan to help people with mortgages. And outside of telling people to call their mortgage company, is there any funding that we can utilize to help keep people from becoming homeless by supporting their mortgage payments?
That is something that keeps me up, as I'm sure it does you, because we know so many people do not have sufficient savings to cover either a couple of months of rent without their paycheck coming in, or a couple of mortgage payments without that. So the short answer is there is a group of people trying to identify what those options look like, working with our Department of Financial Institutions and our financial institutions, both community banks and other financial institutions. We're looking at things like rental assistance. One thing that I just became aware of yesterday is that, and I'm not sure if this was actually even the case in the past, but the new programs coming through the Small Business Administration in the Federal CARES Act that just passed allow proprietors like landlords to potentially apply for small business loans and grants. Now, that's not the same thing as the person in the home that is still required to pay their mortgage. There will be, for a period of time, foreclosure and eviction moratoria, but we all know that when those come to an end, those bills are still due. The federal funding also is going to allow for unprecedented people to receive unemployment payments, including gig workers like my son, who's a musician, Uber, Lyft drivers, etc. We know there are a lot of people that have part-time work or don't have enough traditional hours to qualify for unemployment benefits. This time, they will be able to qualify for pandemic unemployment assistance. So there will be some partial wage replacement coming back on to more individuals than ever before, as well as I said before, the Small Business Administration for proprietors to be able to take advantage of not only loans, but also in some cases a $10,000 grant comes with that loan.
Thank you. And then one quick question around protection for commercial properties.
That's a really good question. I'm sorry, I don't have the answer to it, but I know who on my team has the answer to it, because I do have a team member that's been working with the governor's office and others on those issues. So I will commit to getting that information to your to our hosts here so that they can share it with you.
Great, thank you so much. And yes, please send that my way and Jason's way, and we'll make sure that we get that out to our commissioners. With that, Eric, I will leave the last question to you.
Great. Well, thank you, Director Brown. Thank you very much, and thanks for your staff for making sure that this technology all worked today. I guess my last question for you really is, how do we continue to work strongly as partners, counties, and the state as we face this economic recovery? Any suggestions that you would add to these county elected officials, commissioners, council members, so that we can stay closely connected, understand programs, what you think we might be able to do at the local level to really assist in making sure we get the economy back in shape?
Well, I think this type of activity here where people come together, we share concerns and try to elevate them is a key part of the solution. I would note that we do anticipate further federal assistance and policy, possibly at some point, certainly state policy at some point. Who knows if there will even be a special session at some point. So let's stay coordinated so I can understand your agenda and priorities as they emerge, and can share with you what is coming forward in terms of an economic recovery framework. I can tell you I put some principles out there already. It has to be not just statewide, but it has to be focused on regional economies, meaning urban centers and the rural communities that surround them. It needs to address all the affected sectors, which, as I said before, is everything from agriculture to maritime to global health to tech. We need to look particularly at our most vulnerable populations and how we're going to meet their basic needs, which in many cases means food security and housing security right now at the very top of the list, because some of our food supply chains are disrupted, and certainly we were having issues with international trade and supply chains even before the pandemic, and that continues to be a concern. And then business and community resiliency is ultimately what we want to get to. And working together with you, I think we can identify what some of those key issues are. There will no doubt be some gaps in federal approaches, which means we've got to pull together and then support these priorities at the state level.
Great, and thank you. And I think, two of the vital roles that county government plays in economic development is, one, infrastructure, and would encourage you to constantly keep in mind the Public Works Assistance Account and any of the state programs that make investment in infrastructure, which is one of the vital roles that we play at local government, which is assuring the adequacy of infrastructure to support economic development. And then clearly the Growth Management Act and the things that we do around the planning sector, the zoning, making sure the land availability is in place, and the proper zoning and development regulations. So anything that you oversee in resulting from any modifications, changes, setting aside certain facets that might have been obstacles before to making sure that we plan appropriately and put in infrastructure appropriately would be greatly appreciated.
And Eric, now that you mentioned that, if you don't mind me making just one more point, those
Yep.
are absolutely vital points that you just made there. There are regulatory pieces that under emergency rulemaking are being either delayed or temporarily suspended. So that is another piece. And you mentioned the Growth Management Act. There may very well be a new normal economy for when we start to resume more productive activity again, but still in a situation in which we don't want to ignite other hotspots of the virus. So look forward to working with you as communities share ideas about how to re-engage economic activity beyond what's been currently deemed essential to really re-engage across the entire spectrum. And then second, on the infrastructure piece, thank you so much for mentioning that. I mentioned it only briefly. And I do want to highlight that a big focus of ours right now is broadband and the broadband office and broadband grants coming through the Public Works Board. And we're putting together, and I hope that we'll be in a position to announce soon, a program that is not the ideal connectivity to every home that we all want to occur, that every home and business can cross the digital divide, but at least a set of hotspots, a drive up Wi-Fi spots that people can access if they need to order a prescription or let's say apply for unemployment benefits. Certainly we know this is an equity issue for our students in rural areas who don't have the same access to connectivity that others have. So stay tuned, and we want to work with you on really a massive state investment in broadband connectivity so that we can all transition equitably to some of the new practices that will probably be necessary as we adjust to the effect of this pandemic over the next months and even year.
Great. Director Brown, thank you. I think on behalf of all of our members that are participating and those that will listen in at a later time, we really appreciate you joining us, and I'm sure we will be asking you back at a certain point in time as well. So thank you very, very much.
No, thank you, and thank you for your work that you do on behalf of your communities.
Thanks. Jamie, we'll turn it back to you.
Great, thanks, Eric. I know there's a few more questions that have come in. We'll make sure that we get those over to Director Brown and her team to answer and make sure that she gets the notes from this call as well so that she has those available. Some state resources for you all. The coronavirus website is up and running for our state. It has a link to the Department of Health dashboard as well as contact information for Director Brown and her assistant director. So thank you all. So moving on, some brief situational updates at the federal level, state level, and then some local work as well. So federally, you have heard the 15 days to slow the spread has been extended to be 30 days to slow the spread. You're hearing and seeing in the news a lot of states that are seeing really quick increases of cases and severity of cases, as well as additional states implementing stay-at-home measures, as well as some states not choosing to implement stay-at-home measures. That's all impacting how long our own stay home, stay healthy it will be in effect, because we know that disease travels and disease does not respect borders. And so we want to make sure that we support things that are going on the federal level as much as the things that are going on at the state level. To that end, yesterday, and I'm sure you were all tuned into this as well, Governor Inslee did extend his stay home, stay healthy order that was set to expire on April 6th. It is now expiring on May 4th. That's a Saturday. We do anticipate that in the next couple of weeks, new models will be put out and made available so that we can see again kind of over time how that order is impacting. We expect, and Commerce Director Brown alluded to this, we expect cases in Washington State to peak around the second week of April, perhaps earlier. Again, a lot of that is really impacted by how well everybody respects those orders. But even though things are going to potentially peak earlier in Washington State than in other parts of the country, again, we can't just peak and then go back to quote unquote normal, because then we'll just see a sharp increase in cases again. So we kind of have to ride the curve on the way down, just like we rode it on the way up, which is why you're seeing that long extension over time. So that is what is in place now. A lot of the same measures that are in place are going to be extended. I don't know what that means for schools. I have heard that they're going to try to at least have 1 month worth of school this year rather than cancel it. Again, I've just heard that. So I don't know if that's going to be implemented or not. I know OSPI is working really hard to figure out what to do. A question coming in from Commissioner Sutton: is there any assistance funding to enhance the mental health aspect of the pandemic's effect on the rural communities? I am not aware of any assistance that is specifically targeting mental health and behavioral health. I think that is something on everybody's mind. I know there's been a lot of push towards getting telehealth more readily available for mental health services. That was a big gap that our healthcare system had. I know a lot of things have been done through the Healthcare Authority in getting more access to that, but I do not know of any dedicated funding or program around that. But I will make a note of that to follow up with Healthcare Authority and Department of Health on that question. So that's kind of what's going on at the federal, state level. I'm curious, given the last week that a weekend happened, anything else that's kind of going on in your local communities that you'd like to highlight, anything that you think you guys are doing really well or preparing for, please feel free to type those into the chat box. Would love to hear what's going on in your areas. And as you're typing those into the chat box, just a brief situational update. The Department of Health's dashboard, you probably heard me talking about this last week. It is live. Over the weekend, it went live. It did have a few bugs to it, so it isn't updating as quickly as it is intended to, but those bugs are being worked on, and things are getting updated on a much more regular basis, although it's still a little bit behind. But what is really great about the dashboard is that it has so much more information. It has trend data. It has data around testing by county. It's just a much more rich site for you all to get numbers and to get data around testing and cases and how your communities are being impacted. And it's still being improved on. If there is something that you would like to see that isn't necessarily on that dashboard, there's even a little chat box on the bottom of the dashboard where you can type it in, and they look at that and they compile that as well. So as you can see, we do have an increase in cases. Obviously, we haven't not yet reached peak, but if you look at trend data over time, we are not seeing as significantly as sharp of an increase as other states are. So if you look at like New York's cases or New Jersey or even Louisiana, it's almost like a straight line up. It's that sharp. Ours is much more rounded, which is great, which is what you want to see. And as you can see here too, our total test case counts are going up too. So we're able to do more tests and have been able to do more tests. Still a challenge, still needing to really get more test kits and PPE to our state, but we're seeing a gradual increase in that. So we have a number of questions that have been coming through chat box. So let me pause and go through with those for a little bit. All right. So in Kitsap County, standing up 2 quarantine and isolation centers that will have the capacity to serve 80 Those, they will be available as of Monday. That is great to hear in Kitsap County. I know a number of other counties are starting to look at what those quarantine and isolation or recovery centers might look like. I know King County is setting up a number of them. And I have heard, and perhaps if somebody from Yakima is on the chat box, if you can confirm, I have heard that you received permission to open up the closed Aspirus Hospital as a facility. Would love to hear more about using that facility in this response. From Councilmember Dunn in Snohomish, we are hosting a bi-weekly call for human service providers to provide updates and a deep dive on a single topic. Awesome, that's great. Last week, you focused on resources for mental health and behavioral health, and today was food systems. Providers really appreciate being able to connect directly. That's really great, and I bet Commissioner Sutton, who was interested in mental health, would love to hear more about that. So Commissioner Sutton, Councilmember Dunn is your go-to lady. From Commissioner Price Johnson in Island County, reaching out to schedule a regional county collaboration group reducing transit routes. Yes, that is a really important thing. Reducing, it's kind of a double-edged sword because a lot of people rely on transit, but yet at the same time, you want to make sure that people are keeping those social distancing requirements as well. Councilmember Lambert in King County, an issue in Issaquah where people not being able to use SNAP for another benefit as they are shopping for that person who is vulnerable. That is a really important issue. And if you have not yet let your emergency management and your public health department know that, I will make sure I elevate that so that that can be raised to the state EOC so they're aware of that. Question from Commissioner Skoog. Have you heard what the goal is to start opening up businesses? What is the goal for May 4th? I think what you'll see when we get closer to May 4th is to see where we're at on the trajectory. And depending on where we're at, you know, if we've peaked, great. So if we're on the downside, where exactly on the downside are we? Are we, you know, closer to the top or are we closer to the bottom? And depending on that, what I anticipate happening, and this is again kind of just what I know about you know, public health response, is that you'll see a gradual rollback of the governor's orders. So it won't be everything ends May 4th and everything opens up. You'll see a gradual rollback, similar to what you saw in the beginning, a gradually roll up of those community measures. So you might see, okay, certain facilities and businesses reopen. You might see small gatherings be allowed. And then in a couple weeks, you might see, you know, that next step of larger gatherings be allowed. So it'll be a general roll back, or roll kind of back to normal. And I say normal with air quotes. But I don't think it'll be everything opens May 4th. I think they'll have to look at the data to really see where they are on that epi curve. And the closer we are to baseline, the less restrictive and the quicker that rollback will be. From Commissioner Trask, our EOC team members are amazing. We have been meeting daily with our first responders, schools, hospitals for 4 weeks. We have 3 different places to house the homeless when they get infected with COVID. That is really great. I know EOCs are stressful places to be, so I'm glad to see that that communication and coordination is working. Here's a question from Commissioner Gilder. Is the lack of a sharp projection due to lack of testing? There's probably a number of things in place for that. Testing might be part of that. It's also an impact of people following the stay home, stay healthy orders because we if you think of New York, and it is such an urban core, and Seattle certainly is, but if you think of New York, I mean, there's just a lot of people packed into a really small place. And most people do not drive in New York. They rely on transportation. So just how people interact in New York and on the East Coast is very different from the West Coast. So we've naturally kind of built in some protective measures, just given the fact that we're a little bit more spread out in general. That's probably impacted that as well. Testing certainly has. And then just, you know, being the first is unfortunately advantageous, because we can implement things very, very quickly, where a lot of states that were hesitant to do that, they're seeing increased testing or increases in cases now. All right. Commissioner Fund has a comment, still frustrated and not getting PPE. And I absolutely, yes, I hear you. And I know that is just an ongoing issue. Everybody is frustrated about just the lack of PPE. I know the state had over 3,000 requests for PPE in the last couple of weeks. They've been able to fulfill about half of that. And so they still have half unfulfilled. Given that, they still have a number of priority areas, healthcare, and the workforce that's doing the testing and treatment of individuals is high priority. And there's still a number of folks that use PPE for other things. The state's working really hard in getting PPE. Commissioner Lambert, HIPAA regulations are causing issues with funeral homes, ambulance drivers, police, and hospitals. Yes, HIPAA is a hot issue that has really, I think, risen to the surface this past week. It's a really tough issue, and it's one where it has to really balance the need for privacy, but also the need to be able to empower our first responders as well. It's differently implemented in each county, which also adds to the complexity of that issue. I have reached out to Department of Health to get more guidance on that. Still waiting to hear from them, but I know that's something that all of our local health jurisdictions are struggling with as well. So thank you all for sharing those. I really appreciate that. I think lots of interesting things going on in your communities. Any more questions on kind of situational awareness before we head into state updates and emerging issues? A question from Commissioner Wright in Kittitas, excuse me. Is any additional clarification on the meaning of spoliation regarding residential construction forthcoming? Great question. I believe that the governor's office has put together a work group to work on this issue, and that Jane from the Wasac office, who works with the county engineers, was invited to participate into that group. And I believe she's also let Paul know that that group is going on as well, so that he could get looped in with planners. So I anticipate in the very near future to have more to report on that. And I know a lot of you all are very anxious about that issue as well. So a number of things that have been happening over the last couple of weeks as things have come up. State budget is a big one. We know that we left session with a very rosy outlook, and as Director Brown alluded to, not so rosy of a picture now, and that's really going to impact things moving forward. And so the governor is set to veto a number of budget items, and we also want to have a brief little kind of discussion on county fiscal impact from COVID as well. Let me pause there and see if Eric or Melanie have anything to add around the state budget.
This is Melanie. I can just add that he did just do his budget veto, and OFM put out a list of the things that are on it. There are a couple of things on the veto specifically that do affect counties. The local solid waste financial assistance funding was vetoed. He vetoed about $445 million out of the budget. And so there's a long list there. A lot of studies, including the GMA study and some other things like that, were vetoed. He also has indicated to us that he will veto some bills that would have been helpful to have, but he hasn't actually done them yet. So more to come there. He did sign 1390 into law today, which is the PERS and TERS 1 increase. So we'll see a little bit of a budget impact for that. But I was asked, and I am happy to do so once we have the full list, to put together a list of the vetoes that affect the counties, and also happy to send out the list of cuts to the budget that OFM just released a little while ago.
Great, thanks, Melanie. Yeah, the harsh reality of a recession. And with that, I think it's really important for us to consider the county fiscal impact from COVID response. You've all had to change the way you've done business in response to this. Not only are you looking at a department, your public health department, facing a lot of budget challenges just in their response, but you've had to purchase technology. You've had to figure out how to work with staff requirements from working from home or having staff have leave. It's had an impact to how you've operated. And I think when we look at recovery, and this will be a point later, it's really important to be able to capture that cost and that impact to you all when we start having discussions about recovery from COVID and how you've been impacted. Another thing that's come up lately is corrections. And Melanie, I'll turn this over to you again as well. And the amicus brief discussion. And I just, if you could give like a 30-second update on this issue.
Yeah, definitely. So the ACLU and Columbia Legal Services and other groups like that have filed what's called a writ of mandamus with the Supreme Court, which is basically asking the Supreme Court to make the governor release prisoners from the state penitentiaries and also community custody in the interest of protecting them from the COVID-19. And WAPA, the Association of Prosecutors, reached out to us as well as the sheriffs and police chiefs, victims advocate groups, and others, and we will be presumably, we're working on it, but we still need to technically have the approval, but we'll be doing a brief in that case to talk about what kind of impact it would be to have this influx of, at this point, unknown number of prisoners released into the communities where we just are not set up to handle them at this point, where services are already strapped and we would be releasing into the community people who need services. So it's on a very fast timeline. The initial brief was just filed a couple of days ago. All of the briefing essentially has to be done by the 20th, I think. So amicus briefs have to be in on the 16th. And we will keep you posted. I think a lot of people are worried about what kind of impact this could have into the communities. And so there will be a lot of people paying attention to this. And we will keep you posted.
Great, thanks, Melanie. Another thing, and a few of you reported on this, is the increase of isolation and recovery facilities going up. And this is really important as we're seeing more and more folks enter our healthcare system because of coronavirus, setting up specific facilities and pop-up centers so that people have places to isolate and recover is going to become more and more commonplace, particularly people who need to isolate from others or don't have a place to isolate and recover. And I know, I think it was Commissioner Gelder and Kitsap said that they're setting up a couple. I know King County is setting up several, Snohomish as well. So that is going to be happening across the state in the next couple of weeks. And Director Brown alluded to this too. There was some grant funding received to help set this up. So what this might look like is renting out actual space, like a hotel or motel rooms. It could be renting out RVs and setting up RVs in the fairgrounds or county property. It could be setting up pop-up kind of tented facilities as well. So it looks a little bit different everywhere, but that's the process, is that these are to help kind of with that med surge and providing safe and safe places for people to either isolate or recover. Commissioner Branch let us know Okanagan County has secured options available with the farm worker facility that's being underutilized. Absolutely. Taking advantage of big spaces that right now don't have occupancy. So that is happening, and we expect that to happen kind of as we get to the peak and again on that downslide of our epi curve. And then last but not least, you know, long-term economic and recovery. I think, you know, this is something it's hard to think about, you know, what's life gonna look like 6 months from now, or what's life gonna look like a year from now or 18 months from now. But I think it's really important that we start kind of thinking about that and really trying and making sure that we position counties to be a key stakeholder in that recovery process, as well as help communicate our needs through that economic and recovery process. And I'll pause there. Eric, do you have anything to say on this one?
No, I think this is really vital for us to be thinking about. Wasatch staff has really been pondering this and talking with others around how do we create the outline for counties to be thinking about a 12 to 18 month both response and recovery plan, that we know that until we have a vaccine immunization capabilities on a mass level, we are going to have flare-ups. We may have other cycles. We're going to have hot spots. So how do we both respond as those return, but how do we plan for a recovery? And that's one of the reasons we asked Lisa Brown to join us today about economic recovery. We talked about the state budget at $4 billion shortfall. Those of you that have been here long enough will remember the recession and know it is not a fun process to go through a budget reduction of this magnitude that could be looming for us as well. So how do we think about this in a 12 to 18 month cycle? And we look forward to supporting you and kind of working together collectively on that.
Great, thanks, Eric. And to put that in a sobering context, Council Member Lambert was kind enough to share that in the first weeks, King County has spent $23 million setting up all the isolation and recovery and meeting employees' needs. So $23 million price tag so far. Great. So our time is, we are over time. Dang, I wasn't paying attention to the clock. So thank you for sticking with us. So moving forward, what's your most pressing issue this week? And this is another poll question, so feel free to type it into the chat box, or if you'd like to participate in the poll, feel free to type it into the poll. Mental health, and I am sure that is mental health for your staff, for yourself, for the people that you serve. Yes, sanity, yes. Yeah, 2 to 3 weeks of stay home, stay healthy, and we are not even in the home stretch. It's really tough. Community and those in need, absolutely. Lack of adequate ambulance service, yes. You know, the PPEs and the med surge and the healthcare surge is going to continue to be an ongoing issue, especially as we're nearing that peak. We've tried really hard to flatten that curve to mitigate the impact it has on our healthcare system as much as possible, but we know that they're feeling it. How long will this last? I wish I knew. I believe Walla Walla still has their crystal ball from last week. Maybe they can provide some input. Capacity to respond, that's a really big one. I know we've talked about that in our LHJ calls, all of the case investigations that they're doing. You know, one case might have as many as 50 to 100 people to call in response to that, and making sure that all those people are contacted could take a lot of time. And as you're getting more and more cases, that just builds and builds and builds, and eventually you just run out of the bandwidth to do it. HIPAA versus public right. Yep, that is a big question. Herding cats. I hear you on that. That is a really tough job, especially, and it's a challenging one for our EOCs across the state. I know communication can be a big challenge as well. Adjusting to a longer and unknown timeline, yes. Still trying to figure out how meetings should be run with Zoom. Yeah, this is the new normal is a lot of Zoom meetings, and man, early investors into Zoom. The public hasn't seen the surge in rural areas and has a hard time believing it. I know that's an ongoing issue. And it's really hard to try to get that sentiment to change. To put into some perspective though, if you look at some parts of our state, 2 weeks ago, let's use Yakima as an example, Yakima County, you know, maybe had 10 cases. Over a span of 2 days, they went from 95 cases to over 200. So it might not be there now, but it can change dramatically overnight. And that's just positive cases that have been tested. And if you know, and if we think about, a lot of people with mild symptoms aren't getting tested because they're not necessarily high risk enough to meet the criteria for those limited test kits. We know that it's more widespread than it is. And so it's really tough to combat that. Oh, this isn't anything big, but it can be big, and it can have a really big impact quite quickly once it hits. And that's why it's so important to really stress the stay home, stay healthy. It's not because it's happening to you or happening now, it's because by doing it, we're preventing it. And that's the challenge, is that we don't want to see it. So that's why we're doing this. It's not because we're seeing it and it's happening. Burnout of public health employees. How do we mobilize retired doctors? A number of health jurisdictions have something called the Medical Reserve Corps. And this is volunteer-based that they can mobilize. So if your county does not have that reserve corps, that medical reserve corps, there's a number of jurisdictions that do. I would say pretty much, at least the Big Ten and others do, please have them reach out to other jurisdictions to learn more about that, because that is exactly what the Medical Reserve Corps is to essentially tap in retired nurses, doctors, medical professionals. I've been currently fighting with the state of Wisconsin to get me removed from their Medical Reserve Corps list. I've communicated that I will not be traveling to Wisconsin to help them, but they will not take me off their list. So it does exist, and each jurisdiction kind of has their own list for that. So yes, I know system overload is really tough. Preparing for the surge and what's to come, absolutely. And having the right mindset that we're in these and we're all in this together is really important. A lot of folks saying, good to hear that others are having these same issues, sharing the love. Thank you, Commissioner Trask. Commissioner Gelder says, thanks and stay healthy, everyone. Absolutely. So, yeah, your most pressing issue, you can see it on the screen. Everybody's feeling it, and everybody's in it together. So with that, future topics. Next week, we are planning to have Susie Levine from the Economic Security Department to talk about unemployment. Similar to what we had with Director Brown. Other guest speakers, if there's somebody else or another state agency that you would like to hear from, please let us know and we will start extending that invite. I think it was really valuable to have Director Brown talk about what she wanted to do or what she's planning with her state agency in response. And kind of her long-term plan for her department. I think it'll be very valuable to hear that from others as well that are working on this issue, perhaps, healthcare authority or, oh gosh, you could pick anybody, come and speak as well. So if you're interested in a particular agency or particular topic, let us know. And we'll make sure that we get those invited. So with that, I know we are way over time and I apologize for that. Are there any final questions or final comments? It'd be good to have Department of Health as we near the surge so we know what is happening on the data side. Absolutely. I think keeping a connection with a DOH would be really helpful, and I can reach out to them and see when they think a good presentation might be valuable when that data is starting to show something really great. State emergency management best practices for elected officials from Commissioner Branch. That's a really great idea. We can absolutely reach out to emergency management to see if they would be a guest speaker for us too. Wonderful. Great. Well, I'm not seeing any additional mental health resources from Commissioner Price Johnson, HCA. I'll reach out to HCA and see if they could be a guest speaker as well. With that, we will end our check-in call for this week. Thank you all for participating and staying on the line and staying over time. Appreciate it. Make sure that you talk with loved ones on a regular basis, check in with each other. As you can see, you're all kind of feeling the same issues and feeling the same things in your county as commissioners, and so please utilize each other as resources, as peer support as well. And I wish you all a great weekend. Stay healthy, wash your hands, stay safe, and talk to you all next week. Thank you all.